from the Kraft Agency, Commercial Lines Executive and Employee Benefits Specialist, Jessica Warner. Hi, Jessica.
Hi, Bart. Thanks for having me.
Yeah, good to see you. Last
you
time I
too.
saw Jessica, I think I was in your office because we were going through the Medicare and all that in our family. And it's that time of year for that.
It is, yes. So for individuals over 65, it's every year this year for Medicare Advantage plans. The open enrollment period starts October 1st, actually, although we can't take applications till after October 15th, and goes through December 7th. And then those changes become effective January 1st for individuals.
Why do we have just a limited window of opportunity to make changes?
Because they don't want individuals to get into one plan and then change mid-year, mainly because, as you know, with health insurance and the way that costs increase, if you select a lower cost option and then your health needs change throughout the year and then say, oh, well, I want a different option because it fits my need better at this point, but that costs more, then that throws everything out of whack in terms of, Medicare doesn't really have an underwriting process for those Medicare Advantage plans, but it still skews all of those numbers.
So people, they would get a particular type of insurance so they could get maybe glasses. And then they didn't need the glasses anymore, so they cut that plan and went to something.
Absolutely, yes.
All right.
So that's what they're trying to avoid, really. And that's more of a factor in that under 65 market for individuals that are, don't have any employer-sponsored coverage, so they're looking for something on their own, and they maybe go through the marketplace. That's really where that's factoring into, because they don't want individuals to have the coverage just for a limited time and then drop that coverage. But then when the need arises again, when they have more healthcare needs, they get the coverage for that month. So it really alleviates that, because it really only hurts all of the individuals that are paying like they should, and those costs then balloon.
Like people who would get their car insured just to prove to the Secretary of State.
Absolutely, yes.
All right. So people that, like me, over 65, that got their thing taken care of last year, do I have to worry? Do I have to go through this process again every year?
No. So if you're happy with your plan, if you don't want to make any changes, you don't have to do anything. You just continue to pay your premium, or they actually have options that with the Medicare Advantage space that are zero premium options. So you may not be paying premium, but they do renew on an automatic basis. So every year members get a flyer from their insurance carrier with all of the changes that have been made to the plan. They have to be made aware of that by CMS, which is the Center of Medicare Services, and those changes are just laid out for the members. And if you're happy with what's been happening, you're happy with the new premium, you can just stay status quo as is.
So anyone under the age of 65, this doesn't apply to you, but someday it will. And you'll get the stuff in the mail and you go, Part D, Part B, Part C, what's this, what's that? It really is. It seems like it's a lot of confusion.
Absolutely.
It really, for me, and I remember we went through, you had to explain. It's a lot to.
It is. It's a lot of information, and really, with the market the way it is, you get so many different flyers. Very, very confusing. They don't make it easy. I mean, you have your Medicare Part A, as you mentioned, and B, which comes through Social Security, and then Part D is your prescription, and then Part C is going to be these Medicare Advantage plans, but then they also have the Medigap, which is also called Medicare Supplements. So there's a lot of different terms that can be used interchangeably, which also adds to confusion. So I always recommend, especially for individuals as they get older, even if they're already enrolled in something, take a look at it, review your options, spend time. I mean, I really don't like to do these type of appointments over the phone, because I feel like it doesn't service my customers and it doesn't benefit them to have a quick conversation, because there's so much information. So, I mean, they're not quick appointments by any means, but I feel like I love seeing people come in and then leave thinking, okay, I have a better grasp on how this works.
And I did, and we did, and you're right. It's not something you can do over the phone or
Absolutely.
via email or anything else. But once you do it, you're done. And you can change. So like prescription Part D, that's something that people might want to change. After a year with a particular company, they might decide, well, this really, I know that I could be doing better somewhere else.
Correct, yes. So this time period is also a good opportunity to change pharmacy plans because people's needs change throughout the year too. So, maybe you take more medications than you did last year, or the medications that you're on are now brand name medications instead of generic. So there are a ton of options that are out there. There are a ton of different plan designs, from premiums as low as $3.50 all the way up to $113 in premium. So it's always good to review those, especially if there is a change in, again, your healthcare situation.
Sometimes you'll see an ad, maybe Joe Namath is on it, that says, you can pay less. You'll pay nothing. You can sign up for our thing and it's free. What is that? What's going on?
So that's usually those Medicare Advantage plans. Like I said, they do have plans that are a zero premium, and they have options where you're just going to pay more for those services when you're receiving them. Okay. So from the providers. So you may have a higher copayment. It is nice though, because they bundle that prescription piece right into the plan itself. So you have one ID card, you have one payment if there is a payment. And it's very easy and user friendly for seniors, especially, that don't want the hassle of a lot of cards. But you're going to pay more when you're receiving services from providers.
Yeah, plus you're dealing with somebody who's in who knows where, and with your health, it's too important to trust this to somebody
Absolutely.
in Sarasota.
Yeah, absolutely. I definitely wouldn't recommend, giving a call to a number you just see on TV. Right. Find a local person. I mean, I'm very, very much an advocate of finding a local person that will sit down, take the time, talk to you about it. And if that's still your best option, if you do think that is the route you want to go, then so be it. But at least you're making more of an informed decision.
Right, and it's free to sit down.
Absolutely. Yeah,
and
no cost.
There's some more providers this year. There's additional carriers
There is, yes. So that's a certification process that each agent has to go through. So normally, we pick the ones that are most advantageous for our area. So I work with multiples, added some different prescription carriers as well this year to work with that I think would most benefit our customers. And it's going to vary from agency to agency, I think, but I think we have a really nice portfolio of carriers that we're working with now.
And you also handle group coverage, so employers that have a plan, this is a time that also is open enrollment.
Yes, it's a very busy time of year for sure. Group open enrollment can really be any time throughout the policy year. We do really see December and January as big open enrollment dates though. So it is nice we get to go into employer groups based off of what their need is and what their want is, and have discussions about, what the benefits are, how those have changed, if there is a change. Unfortunately, we're seeing price changes, which is usually about the norm for health insurance. We're seeing prices rise and increase. But that's something that is nice to get out and talk to employers and to talk to their employees and go through all of that and remind them, hey, here's how to use the benefit, and how can you get the most out of it.
During the legislation discussions on COVID recovery, the ARPA, there were discussions being considered that would expand the services that would be offered with Medicare and Social Security benefits to include like hearing aids, but that was scuttled. But since then we've got over-the-counter hearing aids. So seniors that are interested in getting help with hearing, there's insurance for that now. You can have that as part of your plan. Yeah,
so most of the Medicare Advantage plans do include hearing coverage, the exam itself, and then a portion for the hearing aids. And usually the amount that's given is different based off of the tier of the hearing aid that you need. Same with supplemental benefits. There's usually an additional rider that you can add. Most of the group space, that's still kind of a gap in coverage. I've had that question asked multiple times, like, why isn't there anything for hearing aids? And unfortunately, there's just really not a lot of options out there. I mean, some will include a hearing exam, but really it's still just a need for that group space that has not yet been met.
Yeah, well, someday.
Someday.
Yeah. Well, we appreciate you sharing all your information and expertise with our viewers today.
Yeah, thank you for having me.
And people can call you. They'll come in, they'll
Absolutely.
sit in your office and get everything straightened out.
Absolutely.
Thanks for coming in.
Yeah, thank you.
From the Kraft Agency, Commercial Lines Executive and Enrollment Benefits Specialist, Jessica Warner.